Hello, my name's Lawrence Lincoln, and I survived living unhoused on the streets of Oakland, California. Now I serve as an advisor for the Center for Healthcare Strategies, the Patient Council for Trust Clinic, and as a consumer scholar with Camden Coalition. My article, Finding a Place to Be Somebody, documents my journey of recovery and subsequent work as a member of a care community that strives to manifest more positive outcomes for people with complex care needs by forging partnerships between care providers and people with lived experience of the public health crisis that is homelessness, a crisis that was my life for a while. I mean, I was struggling with addiction. I had some serious mental health issues, was living in a world of violence, like feeling like I've been blown away by the world and that I, subsequently given up on myself. But by working with the Alameda County Healthcare for the Homeless, a group that goes out in the streets with street medicine and just comes to, they came to my camp and they just talked to me, and I made a relationship with the people there. I learned to trust them. And by virtue of that, I learned to trust myself. Care that was offered to me, I really want to offer to other people. So I got clean, got back in school, and now I'm able to work with policymakers and people who really care about how to make this work, and what really is meaningful to me is that people with the experience of being out there like myself have a lot to teach people who are out there doing the work to try to make better outcomes for people who are homeless. I think that we can, by working together, there's a much better chance of having more positive outcomes. And I'm a positive outcome, and I've had the great joy of speaking at conferences and working with street medicine teams from all over California. And what I've really learned is that our stories like mine and the stories of the people who are in the service community are in the community that's being served are really important to inform how that care gets administered. And I really encourage you to read my article, Finding a Place to Be Somebody, in the February 2024 edition of Health Affairs Narrative Matters, and consider the benefits of including people like myself and people who have that experience of being out there because they know a lot about what's going on and can really help fill in the gaps of this this really complex endeavor to help people. Our stories are really good data, and I appreciate you listening to mine. Thank you.